Today, I am sharing my insider tips and my essential steps if I was restarting my medical career all over again. Stick around because by the end of this video, you're going to know what to do to get a thriving career in medical coding. Hey everyone, I'm Victoria. I'm a medical coder, auditor, educator, and content creator, and on my channel, I provide tips, tricks, and tutorials to help you be successful in a medical coding career. I've been in medical coding for over 15 years, so the way that I got into medical coding a long time ago is not the same way that I would probably do it today. I had to take in-person classes, I had to take them out in the city, so I would definitely go the online route if I was doing it today. Also, where I got my training from has increased substantially in price since I went, and I don't think it's the correct affordable option anymore. But before I get too far into that, let's talk a little bit about the role of a medical coder. So there's all kinds of different services that happen in the healthcare field, and all of those services that patients have, they get documented. Everything gets written down. There's orders, there's prescriptions, there's notes from physicians to physicians. So there's lots of medical record information. And what the coder does is they go through all of those medical records and abstract medical codes. We have codes for diagnoses, we have codes for surgeries, we have codes for just all kinds of different services, medical equipment, inpatient hospital stays, and depending on what type of coding you do, you may use these different code sets. But the cool thing about medical coding is it's not like a clinical job, so you don't have to handle patients, you don't have to know how to do any kind of medical tasks with things. You just need to know the context of what they are, you need to know the medical terminology, the lingo, and be able to read all of that information and transfer it into codes. Now, of course, healthcare is changing all of the time, different technologies, different advancements, different outbreaks. So as that advances, medical coders have to advance too. So it's something where you really need to commit to continual learning. It's on demand and it's still actually on the rise, even with the advent of artificial intelligence, because everything needs to be scanned and validated by a human. And because healthcare consumption has gone up so much and the complexity of it has gone up so much, we need some additional tools in order to help us keep up with the volume of activity. We've historically had things like computer assisted coding and search tools that help us to get to a medical code, but now it's just working more rapidly. Medical coding definitely keeps you on your toes, it keeps you learning, and it is something that has so much growth potential, as well as flexibility, lots of remote jobs, and competitive salaries. A good volume of medical coding jobs really are going into a work queue where it's all of these different patients and their services, and you might be coding an entire surgery. The provider might have picked like approximately what they think the codes might be. They may have put a placeholder, but in any case, a lot of it is just logging in, going into those healthcare systems and coding all day, every day. Of course, depending on what you want to do, you don't have to do something where it's just coding. There's education, there's auditing, there's just so many different roles. And if there's a particular specialty you like I like plastic surgery, I love working in different plastic surgery coding aspects. Now, one of the things that really appeals to people when they get into medical coding is it doesn't have strong educational requirements. It's really not something where you need an associate's degree, a bachelor's degree, a master's degree. Now, of course, as you are climbing up your career ladder, you might find it beneficial to go out and get your bachelor's degree, especially if you're aiming to work in management or at a higher role. But honestly, the day-to-day medical coding jobs, they are not looking for a degree. What they are looking for is training and certification. They especially want certifications through AAPC or AHIMA. Those are like our Coke and Pepsi in the medical coding world. Those are our two tried and true top tier product brands. So there are other ones out there that are great, but as far as employers and what they're looking for, they want certification through AAPC or AHIMA, especially one of the big ones, the kind of gold star that everyone is looking for and is just an easy point of entry, is the AAPC CPC exam. Now, there's lots of different ways to get training. I went through my local community college. You might have a good benefit through there where you can get like a workforce improvement grant. If you already work in healthcare, there might be organizations that they're partnered with that they'll say, hey, we'll reimburse you for this as long as you pass or get certified at the end of it. I've had friends that have gone through the bachelor's degree programs, for example, at Western Governors University. That's not for everyone, but some people who have gone through it say that they absolutely love it. You can also get training directly from the AAPC. Like if you want to get a huge bundled package, they do that as well. But the one that I endorse and that I highly recommend is Preppy, and you can find out more about that at medicalcodingmasterclass.com. So if you're eager to learn medical billing and coding in as little as 6 months without going into student loan debt, definitely sign up for the free career masterclass. In the masterclass, I spill on everything that I've learned in medical billing and coding in the past decade plus, things like how to save time and money, how to get a discounted training program, and even how you could possibly get a free laptop with your program. It really is that full roadmap on how you go from someone who has no healthcare experience to being fully job ready as a medical biller and coder in as little as 6 months. It really just takes out like all of that guesswork and gives you everything you need. So sign up. Again, it is a free career masterclass. It doesn't teach you medical coding. It teaches you about the career of medical coding. So medicalcodingmasterclass.com, sign up today. So yeah, if I was becoming a medical coder today, I would do the online training, especially since the exams are now going to be online or through computers. I think that helps familiarize you with using that environment, as well as those remote jobs and working remotely on a computer through those jobs. I think that's what I would go through. Especially, it's nice to have that flexibility, especially when you're busy, and a lot of us have families and kids to take care of. It's just knowing that sometimes, you know, those strict hours of, hey, you have to be in class at this hour and you have to commute 30 minutes to get there. Like, it's nice to just know that you have that flexibility of, hey, I'm putting the kids to bed and now I can log in and do my studies. So I would definitely do online courses. I would do them through Preppy, because the thing I love about Preppy is experience is so important. That's one of the number one complaints that you hear in the medical billing and coding field is, I went through this training, I am applying for jobs, but all the jobs out there want experience, but how do I get experience if no one will hire me? Having an internship or externship like they offer with Preppy is going to help you in that aspect. I was fortunate enough to get an internship through my program and be hired off my internship, but some of these programs are having difficulties anymore, and a lot of colleges, universities, and even the AAPC, they do not offer you an externship. So in addition to online training and getting an externship, the next thing I would do is really amp up my job skills. I would probably spend more time on medterm and anatomy than I had previously. My favorite book on this is Medical Terminology and Anatomy for Coding. It is a phenomenal companion to medical coding studies. But also, I'd probably spend a lot of time on professional development, just going through things like LinkedIn Learning or even productivity. I am very rough when it comes to time management, and productivity training would definitely help me out. Right now, I do a lot of Ali Abdaal videos, and he is one of my favorite YouTubers to speak about productivity. I've already pre-ordered his book. He is phenomenal. He used to be a physician. He would document all the stuff he did training in medicine in residency, and then kind of somehow became a productivity expert through his preparations, because everyone was like, how are you doing a YouTube channel and doing medical internships at the same time? So he kind of shifted over to that, which has been really crazy and wild to watch, but he's been so great at it and has such great insights. I would still get the same certifications though. I would still go through the AAPC. Now my problem, if I was redoing it all over again, is one of the certifications I have was Sunset for plastic surgery and reconstructive surgery. They don't offer that anymore. That might change in the future, but right now they don't. It hasn't been offered now in years, but I would still go through the AAPC. I would still get the CPC. I like their community better. I think they are less confusing than AHIMA is. No shade to AHIMA. They're a great organization, but I really have had great experiences with the AAPC, short of a couple customer service things, we'll say, here and there. Next, I would also have to work on my job search strategy. I've seen people that have really amazing spreadsheets that they've put together of like, here's this job, here was what the requirements were. When I applied, did I hear back, so they can follow up on everything. I would definitely get my resume done. There's some great services out there right now. You can check out projectresume.net. I have a link to them in the video description. My friend Sarah Reagan, but she's like bonkers, like busy anymore, so I'm not sure if she's taking too many. She sometimes has to limit how many people she can take in a month. My girl Marissa, I think, is doing resume reviews as well, although I think I heard that the AAPC might be starting up something regarding resumes too. Personally though, I think one of the most critical elements is networking. Getting on LinkedIn, setting up a profile, making sure it's robust, making sure it has the right search components to it. I will link at the end of this video where you can find my video where I go over some of those strategies of what you need for your LinkedIn profiles. But AAPC has amazing local chapters that are so phenomenal with this, where you can connect with other people in your area and say, hey, like, I'm looking looking for a medical coding job, and they know when openings are happening. They know what the good local healthcare facilities are to work for and what may be places to avoid. And a lot of them even have remote jobs that they might say, hey, I work over with Optum 360 or other organizations, and this is what I like about them, this is what I don't like about them. So having those discussions is just so critical. And then lastly, staying updated, because when you're a medical coder, you have to get continuing education credits, and they're going to ask you about that a lot of times on interviews. They'll be like, hey, since you've been certified, how are you staying up to date? And that's when you go, oh, I've been reading Healthcare Business Monthly, I've been going to chapter meetings, I've been staying up to date by reading articles in Medical Billing and Coding Advantage. Like, this is what I've been doing. Or even some of your Medicare contractors have educational sessions so that they know that you are keeping up to date on the industry trends. If I was starting all over again, that is what I would do. I would go and get training through Preppy. You can find out more at medicalcodingmasterclass.com. I would get certification through the AAPC, my CPC certification. I would get that externship, work on my professional development, work on my continuing education credits, my resume, my job search strategies. If you want some more information on how you can get started as a medical biller and coder, check out this video over here. Otherwise, I will see you guys in the next video. And until then, just keep on coding on.